Hi, this is Ken Olson from the Horton Group, and we're talking to food manufacturers and distributors on the impact of healthcare reform. And the first thing that comes to mind is that we have to establish whether an employer is going to be a large employer or small employer in the eyes of the law. And the benchmark there is 50 employees, but what a lot of employers have to realize is that if they have a union component, they have to add that in determining whether they're large or small. So that takes a lot of small employers now effectively are large employers, and there's a different set of rules that they have to follow. Also want to point out that employers over 200 lives have to start to contemplate rolling out auto enrollment and how that's going to work compared to how they've done things in the past. We have really recommended that a process be undertaken by any employer in identifying the impact of the law, and there are various tools that are available. The tool that we're using takes in the plan design, the contribution strategy, and the census, including the W-2 wages, to be able to look at potential migration of members either to the plan or away from the plan, and what are the financial effects of that. What we've seen from people moving on the plan is that today, if your plan has a lot of waivers, a lot of those waivers could turn into enrollees come 2014, and are you ready for the financial effects of that? The other side is people who might want to migrate away from your plan. The two categories we've seen with our analysis are some of the dependents, including spouses that might have coverage available through other employers, and the other would be just the idea of perhaps some of the lower wage workers that find a more affordable option on one of the public exchanges. But really identifying and knowing how your population might shift really helps in the planning in 2014 and beyond. And so we certainly encourage all employers to use a tool to help them make that analysis.